Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Metoprolol Succinate tablet, exploring the various aspects of metoprolol, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Metoprolol Succinate tablet. Metoprolol Succinate is a beta blocker medication primarily used to manage several cardiovascular conditions. These are hypertension, angina, heart failure, myocardial infarction, arrhythmias, and migraines. Next, dosage of Metoprolol Succinate tablet. Dosage varies based on the condition being treated, the severity of the condition, and patient-specific factors. Let's discuss some general guidelines. For hypertension, the initial dosage are 25 to 100 mg once daily, and maintenance dose adjusted based on response, typically 100 to 400 mg once daily. For angina, the initial dose is 100 mg once daily, and maintenance dosage are 100 to 400 mg once daily. For heart failure, the initial dosage are 12.5 to 25 mg once daily, and maintenance dose goes up to 200 mg once daily, titrated gradually. For post-myocardial infarction, the dose is 200 mg once daily. For arrhythmias, the dose is typically 100 to 400 mg once daily, adjusted based on response. For migraines, the dose is 100 to 200 mg once daily. Take the tablet with a meal or just after a meal. Swallow the tablet whole, do not crush, chew, or split the tablet. Consistent daily timing helps maintain an even level of medication in the blood. These are the general dosage guideline. Always take medicine as per prescription, which was recommended by your healthcare provider. Next, mechanism of action of Metoprolol Succinate tablet. Metoprolol Succinate works by selectively blocking beta-1 adrenergic receptors in the heart. This leads to decreased heart rate. By blocking these receptors, it reduces the effects of adrenaline on the heart, slowing the heart rate. Next, it lower the heart rate and contractility, decrease the overall cardiac output. Next, it reduced cardiac output, leads to lower blood pressure. Next, it lower the heart rate and contractility, reduce the oxygen demand of heart muscle, helpful in angina. Next, it stabilizes heart rhythm by modulating the electrical activity of the heart. Then discuss the side effects of Metoprolol Succinate tablet. Common side effects are fatigue or tiredness, dizziness or lightheadedness, depression, shortness of breath, bradycardia, hypotension, cold extremities, and gastrointestinal issues. Serious side effects are severe bradycardia, heart block or heart failure exacerbation, severe hypotension, bronchospasm, allergic reactions, and hepatic dysfunction. Next, important advice for using Metoprolol Succinate tablet. Regularly monitor blood pressure and heart rate to ensure the drug's effectiveness and adjust dosage as needed. Do not adjust the dosage without consulting a healthcare provider. Stopping metoprolol suddenly can worsen angina, cause a heart attack, or lead to arrhythmias. Taper off under medical supervision. Inform the doctor about all medications being taken, including over-the-counter drugs and supplements, as metoprolol can interact with other medications. Report any history of heart conditions, asthma, diabetes, thyroid disorders, or liver problems to the healthcare provider before starting metoprolol. Limit alcohol intake and be cautious with other central nervous system depressants as they can enhance the blood pressure lowering effect. Discuss with the healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding. Be cautious with activities requiring alertness, like driving until you know how metoprolol affects you. Metoprolol Succinate is a vital medication in managing various cardiovascular conditions. Its efficacy depends on correct usage, appropriate dosage, and careful monitoring of side effects and interactions. Always follow medical advice and report any adverse effects or concerns to a healthcare provider. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using metoprolol tablet. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.